Hello, I'm Doreen. Welcome to Individualization of Antiplatelet Therapy with CYP2C19, your clap in 3 minutes. So why is CYP2C19 polymorphism such a big deal? Well, clopidogrel requires a two-step activation into the active moiety. CYP2C19 is involved in both steps. When one carries a star2 or star3 allele, they are termed loss-of-function carriers. When one has a star17 allele, they are called gain-of-function carriers. CYP2C19 loss of function is associated with a higher risk of major adverse cardiovascular events, or MACE, following PCI or percutaneous coronary intervention. Phenotype classifications are derived from permutations of alleles which an individual carries. If one uses a guideline, CPIC or similar, one would find the recommendation for consideration for ticagrelor or prasugrel for intermediate and poor metabolizers. Earlier RCTs were fraught with the issues of underpowering and mixed endpoints. Meta-analyses are useful in overcoming these problems. The first, by Taylor's lead investigator, was published in JACC Interventions. Almost 16,000 acute coronary syndrome individuals, 77% of whom received PCI, were meta-analyzed. Pereira et al. Found that the use of ticagrelor or prasugrel in CYP2C19 loss-of-function carriers was associated with significant reduction in ischemic events, whereas for those who were non-carriers, it wouldn't make a difference even if clopidogrel was used. The p-value of interaction was statistically significant, suggesting the impact of CYP2C19 on the outcomes observed. Galley's meta-analysis in The Lancet clearly shows that MACE and minor bleeding outcomes favor the genotype-guided strategy. The genotype-guided strategy was consistently accompanied with favorable outcomes, whether it involved ischemic outcomes in escalation or bleeding outcomes in de-escalation. The meta-analysis was accompanied by a comment from Sibing himself. In the accompanying schema, we see that thrombotic and bleeding risk factors could be considered along with genotype testing in the individualization of P2Y12 therapy for an individual. This is the very rationale for iWrite4Me, designed as a pragmatic study first conceived by the Khoo Teck Puat Hospital team and now spread to the National University and Ng Teng Fong hospitals in Singapore. Here we create an algorithm which involves ischemic and bleeding risk consideration along with CYP2C19 testing to plan for escalation or de-escalation in the respective subgroups. We hope that more will join us in the proactive ideology of getting it first time right upfront for the patient rather than a reactive approach when an adverse outcome occurs. And that was Individualization of Antiplatelet Therapy with CYP2C19, your clap in 3 minutes. Thank you for listening.